Welcome to MAPI 8 Health Quarter 3 Week 8. Our most essential learning competencies for Week 8 Health analyzes the nature of emerging and re-emerging diseases, demonstrates self-monitoring skills to prevent communicable diseases, promotes program and policies to prevent and control communicable diseases, and identifies the agencies responsible for communicable disease prevention and control. Emerging diseases are the newly identified and previously unknown infectious agents that cause public health problems either locally or internationally. The following are the examples of emerging diseases. We have the Ebola virus, which was emerged on 1976, HIV/AIDS on 1983, Hepatitis C 1989, and SARS 2003, H1N1 flu, we have 2009, and others. Re-emerging diseases are all diseases which are previously controlled but once again have risen to be a significant health problem. These are diseases that were once major health problems globally or in a particular country and then declined dramatically but are again becoming health problems for a significant proportion of the population. These terms also refers to that diseases which was formerly confined to one geographic area has now spread to other areas. Ebola. Ebola, or also known as Ebola virus disease or EVD, is a viral hemorrhagic fever in humans and other primates caused by Ebola viruses. The disease typically occurs in outbreaks in tropical regions of sub-Saharan Africa. From 1976, when it was first identified, through 2013, the WHO reported 2,389 confirmed cases with 1,590 overall fatalities. The largest outbreak to date was the Ebola virus epidemic in West Africa, which was caused a large number of deaths in Guinea, Sierra Leone, and Liberia on 2014 to 2016. The first example of re-emerging diseases is hand, foot, and mouth disease. Hand, foot, and mouth disease, or HFMD, is a highly contagious viral disease which affects all cloven-footed animals like cattle, buffaloes, sheep, goats, deer, yak, bison, and others. It was first documented in the United States of America on 1870 and its recent outbreaks was on 2010 to 2011 in Japan and Korea. The disease is characterized by the development of vesicles or blisters-like lesions in the mouth and feet, excessive salivation, and lameness. The mode of transmissions, direct to animal, through contaminated feed and water, contaminated equipment, utensils, clothing, or shoes, and contaminated uncooked food. We can prevent and control this kind of disease by getting a vaccination of FMD vaccine and wash our hands and proper hygiene. Next, let's discuss the swine flu by AH1N1 virus. Swine influenza or swine flu is a highly contagious respiratory disease that occurs in pigs that is caused by the influenza A virus. Swine flu was first proposed to be a disease related to human flu during the 1918 flu pandemic, when pigs became ill at the same time as humans. The first identification of the influenza virus as a cause of disease in pigs occurred about 10 years later in 1930. The recently recorded outbreak was in the Maldives in 2017. Symptoms: fever but not always, chills, cough, sore throat, runny or stuffy nose, watery red eyes, body aches and headaches. Mode of transmission: contact with infected pigs or environments contaminated with swine influenza viruses. Prevention and control consists of bed rest, increased fluid consumption, cough suppressants, and antipyretics and analgesics. Lastly, the avian influenza or bird flu by H5N1 virus. Avian influenza refers to the disease caused by infection with avian influenza type A viruses. The most widely quoted date for the beginning of recorded history of avian influenza, initially known as fowl plague, was in 1878 when it was differentiated from other diseases that cause high mortality rates in birds. By the end of 2020, several outbreaks of avian flu of various varieties were reported in Europe. Symptoms: persistent fever, lymphopenia, severe pneumonia or ARDS. Mode of transmission: human infections with bird flu viruses, exposure to sick poultry, to affected areas or sick person. Prevention and control: protective actions around birds. Avoid contact with sick birds, areas, and person. Prevention and control of communicable diseases may start with each individual person. But to be more effective and on a larger scale, the government is also implementing programs and policies for the prevention and control of communicable diseases because the community's health is a concerned effort of all stakeholders. Now let's discuss the different agencies in our government that are responsible for the prevention and control of communicable diseases. Interagency Task Force on Emerging Infectious Diseases, or the IATF-EID, or simply the IATF, is a task force organized by the executive of the Philippine government to respond to affairs concerning emerging infectious diseases in the Philippines, like the COVID-19 virus. Department of Health, or DOH, is the one directly in charge of the prevention and control of diseases. World Health Organization, or the WHO, is the directing and coordinating authority for matters concerning the health of recipients within the United Nations system. United Nations Children Fund, or the UNICEF, is an organization that protects and defends the rights of every child all over the world. And the Department of Education, or the DepEd, supervises all elementary and secondary education institutions, including alternative learning system, both in public and in private, and provides for the establishments and maintenance of a complete, adequate, and integrated system of basic education relevant to the goals of national development. Healthy practices or personal practices protect you away from viruses and prevent you from transmitting infectious diseases. There are a variety of ways that you need to adapt and learn to keep you from contracting diseases. Welcome to Wash Camp. Wash Camp means wash your hands regularly, avoid sharing personal belongings, stay and rest at home when sick, handle and prepare foods hygienically, cover your mouth when you cough or sneeze, avoid touching animals that may bring diseases, make sure you get vaccinated, and properly disinfect and clean surfaces like toilet bowls, sink, and others. Always keep in mind, it takes a community effort to ensure the healthy well-being of its constituents. There are a variety of programs and policies in operation geared toward improving individual and community health. There are many factors that can make a healthy and safe community. Such a community is a haven for living, learning, working, and playing. Being healthy is a personal responsibility. To be healthy is a choice. Self-monitoring is a process of observing one's behavior and evaluating it in relation to one's goals. Disease prevention and control is a very important health concern because it affects the quality of people's lives. Communicable diseases not only threaten the sick person, but also his or her family and society in general. Thus, protecting ourselves and our families from diseases is both personal and social responsibility.